All right, guys. Well, we're the Golgi body. We're going to be focusing on chapter 30, working our concept map on that chapter as well. My name is Jacques. I am a biology major. I'm a junior at LSU. And I'm going to get the other guys to introduce themselves as well.
I'm Luke. I'm a Kinese major, and I'll be doing the second part of this chapter.
I'm Jacob. I'm a bio major, and I'll be doing the third section of this lecture. And I also will be explaining our concept map on chapter 30.
I'm Garrett Ryman. I'm a biochem major, sophomore, and I'll be starting off our lecture on chapter 30 with epidemiology and public health. So sort of the language of epidemiology. Um, Epidemiology itself is the study of the occurrence or distribution of diseases and really the public health as a whole. And so identifying the pathogen and its major form of transmission is really the goal of this sort of section of science. And in developed countries, diseases cause fewer deaths. However, in developing countries, there are far more deaths just due to a lack of vaccinations, lack of clean reservoirs such as water and whatnot. And it accounts for nearly half of all deaths in developing countries. Um, so starting off talking about some of the terms in epidemiology, you have incidence and prevalence. So incidence is just the number of new cases in a given period, whereas prevalence is more of a ratio. So the prevalence of the disease, new and existing cases in a population. So it's expressed as a percent, whereas incidence is kind of focused more on the rate aspect of the pathogen. So talking about the scope of disease, it's really just the range, how widespread it is. So a pandemic is usually global. So that's like what we experienced with COVID-19. It's experienced all around the planet. Whereas an endemic is felt kind of in lower incidences and it just sort of stays around in the population, but really isn't that um, potent in itself. And the main reservoir, and reservoir is just a term where the pathogen resides, will be human or non-human. So talking about carriers now, people who show no or mild symptoms can carry this disease without them even realizing that they have it, and those are called carriers, and they can spread the disease to others who are more susceptible to the disease. And there are stages to the disease, with the most felt presence called the acute phase. That's where symptoms are generally the worst. But starting off, you have infection, which is when the organism invades. The incubation is sort of that time between where it's beginning to grow. And the acute periods when symptoms are the worst. The disease is at its height, so we'll be experiencing things like fever um, and other symptoms, just depending on the pathogen. And then you have the decline period and the convalescent period, which is when the patient regains its strength, his or her strength, and is feeling better. And then some of the final terms that we have in the language of epidemiology is mortality, which is really just the amount of deaths that this disease has caused in the population. And then morbidity, which refers to if you can track the disease or if it's killing people. So morbidity is really a better statistic when talking about the prevalence or incidence of a disease. And then you also have something called the disability adjusted life year, or the DALY, which pretty much just measures kind of years lost that come from the disease. So if the disease is rough on your body, you can have a premature death that you account for in the DALY.
Okay, so the next part is about the host community. And so to start it off, coevolution is a host and a pathogen. Uh, it's common. The virulence of the parasite and host-to-host transmission diminishes, and the resistance of the host increases. So a host-to-host pathogen that kills its host before it can infect others may become extinct. Ebola will evolve into a milder form with time. If a pathogen does not rely on host-to-host transmission, it may remain extremely virulent, like E. coli in hospitals. So the next part is herd immunity, and it's defined as the resistance of a group to infection due to the immunity of a high proportion of the group. And if a high proportion of the individuals are immune to an infection, then the whole population will be protected. Immunized people protect non-immunized people because the pathogen cannot be passed on and the cycle of infectivity is broken. Other diseases like the flu tend to occur in cycles. And next, I'm going to talk about the modes of disease transmission. So a pathogen transmission can be direct or indirect. For direct host-to-host transmission, infected individuals transmits a disease directly to a susceptible host without the assistance of the intermediary, such as the flu, common cold, STDs, and ringworms. Indirect host-to-host transmission occurs when transmission is facilitated by a living or non-living agent. These are called vectors for the non-living or for the living and fomites for the non-living. Next is disease carriers and disease reservoirs and control. So reservoirs is defined as the sites in which infectious agents remain viable and from which individuals can become infected. So a number of infectious diseases are caused by pathogens that propagate in humans and animals. For other pathogens, non-living matter serves as reservoirs. For example, soil is a reservoir for Clostridium tetani. Next is zoonosis, and that's any disease that primarily infects animals but is occasionally transmitted to humans. And the control of a zoonotic disease in the human population may not eliminate the disease as a potential public health problem. And certain infection diseases have a complex lifestyle involving an obligate transfer from a non-human host to humans, followed by a transfer back to the non-human host. Next is major epidemics are classified as common source or host-to-host epidemics. Common source epidemic usually arises from contamination of water or food, like cholera. And in a host-to-host epidemic, the disease shows a slow progressive rise and a gradual decline, like the flu and chickenpox. And for carriers of the disease and these epidemics, pathogen infected individuals showing no signs of clinical disease, potential sources of infections may be individuals within the incubation period of the disease, and they can also be identified using diagnostic techniques like PCR and culture. Typhoid Mary is also an example of a carrier.
And also going into how diseases are spread, there's something called a basic reproduction number, which is basically a measurement of secondary cases which stem from a single case. So basically how viral an infection is when one person has it, how easily it spreads to another. And then going into some other vehicles, some common vehicles of infection are food, water, and air. But different different governments and society have implemented controls in order to prevent some of these diseases from spreading more easily, such as food laws, which require certain foods to be purified, water purification, and however, airborne pathogens are difficult to control. Um, and controls directed against reservoirs, which is basically a different source of an infection. So if a reservoir is an animal, then it can be immunized or destroyed. However, if the reservoir is human-based, they can be difficult to eradicate, and humans who are infected must be quarantined, immunized, and treated. And this was the method that the World Health Organization used to eradicate smallpox. And different measures of quarantine include isolation and surveillance, and these are all controls that are directed against transmission of pathogens. Immunization was used to eradicate smallpox, rubella, and tetanus. Quarantine is when you just restrict the movement of an individual and you keep them in an area where they can be treated without a higher risk of infecting others. And then surveillance is just the observation and report of different diseases and how they spread. So the goal of eradication is to remove a pathogen from a reservoir, and such as smallpox or polio. And polio has been almost completely eradicated. In 2018, there were only 33 cases of polio worldwide. However, in less developed countries, such as countries in Africa, they have a much higher death rate because there's a plethora of different infectious diseases, whereas places like the Americas don't have as harsh diseases. However, America does suffer from upticks of cancer and other cardiovascular diseases. And this is a problem for travel, where travelers have to be immunized depending on where they go in the world. Otherwise, they can spread these diseases to places where there's no immunization, and stuff like drinking contaminated water can help spread that. And then, as far as emerging and re-emerging diseases go, disease distribution rapidly changes worldwide, and they can suddenly become prevalent or emergent. And re-emerging diseases become prevalent after having been under control, so they come back in a worse form after, such as a biotic being immune to an antibiotic, and this causes people who treat diseases to have to come up with new solutions. And different diseases come from pathogens and vectors, such as Lyme disease and tuberculosis. And this is covered in our chart, in our flow chart. Our flow chart mainly focuses on disease, and we have 5 different categories for disease. The first one is specific diseases, and types of diseases, such as viral, fungal, and bacterial. And we have examples for viral. We have HIV and AIDS and influenza. Fungal, we have athlete's foot, ringworm. And bacterial, we have meningitis and cholera and tuberculosis, just to name a few. Another category is of diseases transmission, and different categories of transmission are direct contact, indirect contact, vehicle transmission, and vector transmission. And for disease scope, which is the amount and the rate that individuals are affected, different disease scopes are pandemic, epidemic, endemic, and outbreak. A pandemic is a global wide epidemic. An epidemic is usually just a high population that is infected. An endemic is when a disease is prevalent in low numbers, and an outbreak is when a disease has a high infection rate in an area. There are different disease stages that we've already gone over. There are 5 of them: infection, incubation, acute, decline, and then convalescent disease. And then disease incidence is the number of new cases. The prevalence is the proportion of the population infected. Morbidity is the fatal and non-fatal infections, and then mortality is all deaths from infection.
So just to continue as well, talking about emerging and re-emerging infectious diseases, the emerging factors largely depend on demographics and behavior of humans. And the big part about addressing emerging diseases is recognition and intervention. And it's important to prevent the spread of emerging infections, which is done by public health response, which includes, as we previously talked about, quarantine, immunization, and drug treatment. A couple of examples of pandemics would be AIDS, acquired immunodeficiency syndrome, which was and still is a viral disease that attacks the immune system. The first case that was reported about this disease was in 1981, and at least 70 million people were infected worldwide with HIV, and more than 25 million of these people have died from AIDS. Another example of a pandemic would be cholera. It can be an epidemic, but it causes severe water loss, diarrhea, and it's transmitted through ingestion of contaminated water. It's more common in developing countries where they share a common water source. It's endemic in Africa, Southeast Asia, Indian subcontinent, and Central and South America. Another example of pandemic is the influenza pandemic, which occurs every about 10 to 40 years. And it's caused by a major change in the influenza genome. Basically, every year they have to come out with a different vaccine because it's constantly changing due to antigenic drift and antigenic shift. Antigenic drift is a minor change in the virus due to gene mutation, whereas antigenic shift is a major change in the virus due to gene reassortment. This was in 2009 known as a swine flu pandemic, the H1N1 influenza, where the pig in Mexico became all infected with influenza, and bird influenza and human influenza, which has caused reassortment of the disease itself. There are also worries about biological weapons. So that's been the biggest fear. People were worried about anthrax for a long time. Characteristics of these microbial weapons are that biological warfare can be used to kill like an entire military or a population, and they are very easy to produce and deliver. They're safe to use by the offensive, and they're able to incapacitate or kill individuals in a consistent and reproducible manner. They're virtually all pathogenic bacteria or viruses can be used in this manner. Bacterial toxins such as the botulinum toxin are also potential biological weapons. Smallpox virus has intimidating potential as well as a biological weapon because it can be easily spread by just contact or with aerosol spray. As we talked about earlier, it's very difficult to control these airborne pathogens. It can be debilitating, which can cause disfiguring rash and fever. Its mortality rate is over 30%. And we do have a vaccine for smallpox, but it hasn't been used in the population since 1980 because it was eradicated worldwide. We do know that the chance of it being used as a military weapon is low because the militaries are routinely still vaccinated for smallpox. As I said previously as well, anthrax is the biggest fear for biological warfare and biological terrorism. It's spread by endospores. Well, it is endospores, and there's three forms of this disease. You have cutaneous anthrax, which is found on skin, gastrointestinal anthrax, which is in your gastric system, and your pulmonary anthrax, which attacks the lungs. And then just to go over a couple more of the bacterial infectious diseases that Jacob already covered. We have, I'll go over four of them for us. We've got Borrelia burgdorferi, which the disease is that causes Lyme disease, which has symptoms of rash, fever, cardiac abnormalities, arthritis, and it's spread by ticks. And there was a large increase in deer and human population in these wooded areas. So that's the biggest place where this disease is found. Mycobacterium tuberculosis is the disease is tuberculosis, which the symptoms are cough, weight loss, and lung lesions. And this comes from droplets. So it's spread by the droplets from a cough or a sneeze from somebody with the active disease. Another one would be Vibrio cholera, which causes severe diarrhea, rapid dehydration. And as previously stated, once again, it comes from the water contaminated with feces of infected people. That's why it has such a high emergence in lower developed countries, because of the fact that there's usually a big sharing of a common water source. So it's worrisome for these countries because they have poor sanitation and hygiene control. So it can really cause some issues to the population. I'm gonna pass it back to Jacob to see what else he has to say about finishing up that little concept map. So I'm gonna pass it to him.
Yeah, just more specifically about the viruses, stuff like influenza that can be spread comes from causes fever, headache, cough, and nausea. And this is spread through direct contact with either infected animals or humans, and it can be spread through aerosols. So stuff like coughing helps spread it. And this is a danger of animal and human virus reassortment, which is why it's reemergent every year, even if we can produce a correct vaccine for one strain, the next year, because of the animal human reassortment, it ends up being a little different. And then viruses such as Zika virus, they are asymptomatic, such as fever and rash, and they cause muscle, joint pain, and headache. And this is spread through mosquitoes, which can even affect, if a woman is pregnant, it will affect the fetus that she is pregnant with. And it also can be spread through sexual contact or blood transfusion, so different fluids of the body. And this is popular in underdeveloped countries, once again, due to the way you eradicate it and the way it emerges is through mosquitoes. So, poor mosquito control with a high population density means that it ends up spreading more. And then for fungal infections, some fungi such as athlete's foot or ringworm or candida, which is a fungal infection of the gastrointestinal tract, and this is called by microbiota, which is that are opportunistic pathogens, which it is spread when someone comes in contact with secretions or excretions from an infected person, and it emerges through immunosuppression of medical devices such as a catheter or antibiotic use.